Thank you so much, Representative Khanna, for your amazing leadership on this and so many other issues, and for connecting all of the things that we're talking about, from the loss of health care to automation to the loss of jobs. Senator Markey, you are always on the front lines of all of our progressive issues, and I am so grateful to you for your leadership, for your stewarding of these incredibly important issues. And to all of the state leaders here, it makes me so excited to see you, because when I do the Medicare for All conferences, you are the ones in the room. You are the ones continuing to push on the front lines to build the coalition that we need to build. And we are gathered here today because it's no secret that in the United States of America, the richest country in the world, we have a for-profit healthcare system that puts patients last, not first. In the richest country in the world, it's criminal that 85 million people are uninsured or underinsured. It's criminal that 100 million Americans have medical debt that totals 200 billion with a B, dollars. It is criminal that even as more and more Americans suffer and die because they can't get health care that they need, the 5 largest private insurance companies had $371 billion in profits over the last decade, all by denying claims and by raising prices for essential care. And what's most criminal of all is that after seeing all of that, what do Republicans do? What Representative Khanna, what Senator Markey both talked about, is they decided to pass and sign a bill that kicks 17 million Americans off of their health care, all so that billionaires can get a giant tax break. So if they're successful, we have Americans that are sicker and poorer. If we are successful, we have a country that actually values the health care of every single person in America from birth to death. I always say that we've never suffered from scarcity in America. We suffer from greed. And there's really no other issue that showcases that as beautifully and terribly as this one. So today I'm really proud to stand with my colleagues, activists, and organizers as we reintroduce the State-Based Universal Health Care Act. Roe is generous in giving me the credit, but actually it was my predecessor, Representative Jim McDermott, who was a physician in the House of Representatives, that first introduced this bill, because he felt like at the same time that we were pushing for Medicare at the federal level, we needed to have a way for states to access the federal dollars, the stream of dollars for healthcare, so that we could create our own state-based universal healthcare programs. So this bill does exactly that. It gives states access to federal funding, to the necessary resources to build out these plans. It allows all of these state legislators to have the dollars that they need to support universal health care and show us how it's done. We can do this at the state level. We can do this at the federal level. I'm going to keep pushing for Medicare for All. That is, I'm so proud to lead that bill with Congresswoman Debbie Dingell, with so many of the partners that are here today. Everyone is a part of the Medicare for All movement, but we need to pursue it at both the state level and the federal level. There's recent polling. I mean, the polling has been clear on this issue for so long. But if you want to get the most recent polling, over 60% of Americans support a universal healthcare system. It's not just good policy. It's not just good economics. It's actually really, really popular. And it's not a radical idea. Anyone who wants to paint this group of legislators as naive or idealistic just needs to go to any other country in the world that is as rich as the United States of America, and you see that you have a healthcare system that isn't dependent on your job, isn't dependent on when you sign up, doesn't have all these different pieces that allow private insurance companies, private drug companies, all of these private entities that benefit from being able to take over the system. That's what we're driving here today for, and we can do that by both passing the State-Based Universal Healthcare Act and, of course, by continuing to push for and pass the Medicare for All Act.